actually, if there is one thing that we can be proud of today, it's that the future of healthcare leadership is strong, because you are our future healthcare leaders.
Let them take our funds away, tax the rich and make them pay.
Bursary or bust! Bursary or bust! You know what the government wants to do? It's done austerity, it's cut people's pay and conditions, and now with loans for student nurses, it wants to make people pay to work in the public service. We are out here today to say no! Enough is enough, and you can try and break us, but you will fail! NHS! NHS!
The average age of a nursing student is 29, so there are people with children, between childcare, which isn't an issue for me but is for a lot of my colleagues, and working 9 to 5 free for the NHS effectively whilst training. There isn't time to do a part-time job, there isn't time to do extra work. And at the end of all of it is going into a career in public service that people have chosen not because of high pay but because they care about it. And therefore, I think it's important that there is an element of incentive, even though that incentive doesn't cover the costs of doing the course, and that people are rewarded for choosing a career in public service, in caring for others.
My mother took up a nurse's bursary in 1930, it would have been, in England, and she learned how to be a nurse, and she was able to spend her whole professional career looking after people, which is what she wanted to do.
What do we want? Free education. When do we want it? What do we want?
Sisters and brothers, I want you to believe in your own values, to believe in the values of fairness, of decency, of equality. I am confident that your strength, your enthusiasm, your commitment to our communities will win the day. Stay strong and justice will prevail.
Lives that we save, the price that we pay, long hours turn into days. Yes, we get run down, but still we stand proud. So listen when you hear us shout.
Only 4 hours left of this awfully long night. My mind can't stop thinking of the assignments I've still left to write. A new day on placement, there's so much to learn. Do this and that again. I have no time to earn.
It's something that affects everyone, all normal people. And they're not even trying to hide it anymore, which is despicable. It's disgusting. They've planned it and they know what they're doing. Yeah, it's going to separate us even more. There's going to be the poorest of the poor, and there's going to be that 1%.
Bursary or bust! Bursary or bust! Bursary or bust!
I passionately love our NHS. If they change the junior doctors' contracts, and if they scrap the nurses' bursaries, and if they really prove to us that the NHS is worth nothing to them, I'd like to say I'll stay and fight, but I have children and I can't afford to stay and fight.
If they can find money for tax breaks for the riches, if they can find money to let the corporations off, avoid tax and all of these kinds of things, then they can find money for our health, for our homes and for our education. This is our message today.
Royal College of Midwives is absolutely appalled that the government never consulted with us, never asked our advice, never asked our students, and never asked our midwives what the implication of this policy would be. Yet again, they have devised a policy based on the back of a postage stamp, and they haven't thought through the implications.
Save our NHS! Save our NHS! Save our NHS! Save our NHS! Save our NHS!
Jeremy Corbyn sent a message to be read here, giving us his full support, should really put some fear into David Cameron.
That should be yours.